It was 2 p.m. on a hot Tuesday afternoon. She sat in my office, hands trembling, holding an unopened bottle of Wellbutrin. Her doctor said it would calm her anxiety and help her drop a few pounds. Two things he forgot to mention. Wellbutrin can make anxiety dramatically worse in the first 2 weeks, and at high doses, it can even cause seizures. But there are several other things you should know before taking this medication. I'm Dr. Eyre, quadruple board-certified psychiatrist. Wellbutrin, also called Bupropion, is not like the other antidepressants you've heard of. SSRIs like Zoloft, Lexapro, and Prozac work mostly on serotonin, your calming chemical. Wellbutrin works on two completely different chemicals, dopamine, which helps your motivation, and norepinephrine, produced largely in a brain region called the locus coeruleus, your built-in alarm system, helps keep you alert. So Wellbutrin turns up your motivation and alertness. For someone who feels flat, foggy, and exhausted, that can feel like the lights coming back on. But for someone whose nervous system is already on high alert, turning up alertness is the last thing they need. Here are 5 things you need to know about Wellbutrin. Number 1, it can worsen anxiety. In the first 1 to 3 weeks, Wellbutrin can increase anxiety, jitteriness, and insomnia. I had a patient in her late 40s come to me after her primary care doctor started her on Wellbutrin for anxiety. Within 5 days, she felt like she'd been drinking 5 cups of coffee daily. Her HPA axis, the body's central stress system, was already on overdrive from years of chronic stress, poor sleep, and hormonal shifts. Wellbutrin poured fuel on a fire that was already burning. And this is not surprising, as Wellbutrin is an antidepressant we prescribe for depression, not anxiety. Chronic stress over decades changes how the body responds to stimulation. So a medication that activates the system can backfire. Number 2, it can wreck your sleep. Wellbutrin is activating. That's the whole point. But activation at the wrong time of day means you stay at the ceiling at 2 a.m. wondering why your brain won't turn off. Poor sleep is one of the biggest drivers of anxiety I see in my practice. Unfortunately, the medication meant to lift your mood can wreck the very thing your brain needs most to heal. This is why timing matters. Wellbutrin should not be taken at night, and if you're already a poor sleeper, this medication may not be the right starting point. If you've been struggling with sleep, I put together a free sleep guide that walks you through the exact steps I give my patients. It's in the description below. Number 3, the weight question. SSRIs like Paxil, Lexapro, and Zoloft can cause weight gain, sometimes 10, 20, or even 30 pounds over a year or two. The mechanism is part appetite, part metabolism, part changes in how serotonin influences cravings and fullness signals from the gut. Wellbutrin is the opposite. Studies show that some people can lose up to 4% of their body weight. It changes the levels of dopamine and norepinephrine. These chemicals help control hunger and how much we enjoy food. Because of this, some people who take Bupropion feel a little less hungry and may lose some weight. Compare this to mirtazapine, another antidepressant, which often causes significant weight gain and increased appetite. The SSRIs sit somewhere in the middle. But this same mechanism is why Wellbutrin can be dangerous for anyone with a history of an eating disorder. Suppressing appetite in a brain already wired to restrict food can pose a serious risk. This is why Wellbutrin is contraindicated in people with eating disorders. Now remember to subscribe if you find this content valuable. Number 4, it is approved for treating depression, seasonal affective disorder, and ADHD off-label. Wellbutrin was never designed as an anxiety medication. It is an antidepressant and a smoking cessation tool. The research on Wellbutrin for pure anxiety is thin. The research for depression, mixed with low energy, brain fog, and ADHD-like symptoms is much stronger. So if your main problem is racing thoughts, panic, or a nervous system that will not settle, Wellbutrin is probably not your best option. But if your main problem is feeling flat, unmotivated, foggy, and emotionally numb, especially after an SSRI caused emotional flattening and weight gain, then Wellbutrin can be a game changer. Number 5, seizure risk and what happens in an overdose. Bupropion can slightly raise the chance of having a seizure, and the risk goes up as the dose gets higher. At lower doses, up to 300 milligrams per day, the chance is very small, about 1 in 1,000 people. At medium doses, 300 to 450 milligrams per day, the risk increases to about 4 in 1,000 people. At doses above 450 milligrams per day, the risk jumps significantly, almost 10 times higher. This is why we're careful not to prescribe too high a dose and why we raise the dose slowly over time. Here is something else you need to know. Wellbutrin is one of the more dangerous antidepressants in an overdose. SSRIs, while not harmless, are generally much safer if someone takes too many. Wellbutrin is different. In an overdose, the same mechanism that makes it activating becomes the threat. Seizures can occur hours after the pills are taken with the extended release preparation. Heart rhythm problems can follow. In severe overdoses, a life-threatening seizure state called status epilepticus can develop. This is why I never prescribe large quantities to a patient in crisis. And it is why anyone with a history of eating disorders, heavy alcohol use, or certain neurological conditions should not take this medication. Stopping alcohol abruptly while on high-dose Wellbutrin also lowers the seizure threshold and can lead to seizures. For everyone else, the risk is low but not zero, which is why dosing matters. I almost always start patients on the lowest dose, 150 milligrams extended release, and we go slow. But let's talk about the real issue with mental health disorders, whether it be anxiety, depression, or other conditions. Because this is where psychiatry misses the mark. You see, the root cause is almost never just a brain chemical issue. Anxiety, for instance, is rarely just a serotonin problem or a dopamine problem. It is usually a whole body problem showing up in the brain. Inflammation in the gut sends signals to the brain that mimic anxiety. Insulin resistance and blood sugar swings can trigger panic attacks out of nowhere. Problems with your mitochondria, the energy factors in your cells, can leave you feeling wired but exhausted at the same time. Hormones can play a role, especially later in life. Drops in estrogen, progesterone, or testosterone can make your anxiety seem worse. I had a patient, a man in his 50s, high-functioning executive, put on Wellbutrin for what his doctor called depression. This made him feel worse. Further investigation showed his testosterone was low and his thyroid hormones were elevated. His vitamin D level was also extremely low. So we worked on these issues. 3 months later, he no longer needed Wellbutrin. I understand that many people say Wellbutrin saved their lives or destroy them. Both can be true. So you must speak with your doctor to ensure that you're the right fit for this medication. And there's one more thing. For some of you, even the right medication alone will not be enough. If your gut is inflamed, your hormones are depleted, your blood sugar is on a roller coaster, and your sleep is in pieces, no pill is going to outrun that. Medication can be a bridge, sometimes an essential one, but medications do not address the root causes. And before you start any psychiatric medication, ask your doctor 3 questions. 1, what is the lowest effective dose for me? 2, what are the side effects and exit plan if this does not work? 3, which vitamin levels, hormones, and root cause factors should we check first? And that's exactly what the next video talks about.